Presentation is Quantifying Age-Related Brain Volume Changes to Support Neurodegenerative Disease Drug Development. And we'd like to thank our speaker, Dr. Cesar Pichardo, and also mention that this presentation has been done in collaboration with Dr. Diana Klausmeister at AbbVie and Dr. Neil Benson from Certara. Today's speaker is Cesar Pichardo. He is currently a principal scientist at Certara. Prior to coming to Certara, he earned his master's degree in chemical engineering and a master's in systems engineering from the Simon Bolivar University in Venezuela. He then went on to earn a PhD in applied mathematics from the École Centrale de Lille in France. Cesar brings to Certara more than 15 years of experience developing biological, physiological, and medical models for lifestyle interventions, drug development, mortality risk, and actuarial science. Cesar, welcome to today's event. I'll now turn it over to him.
Thank you, Susan. Hi, everyone. Before I start, I need to disclose this slide. So basically, I need to say that myself, Cesar Pichardo, and Neil Benson are employees of Certara, and Diana Klausmeister is an employee of AbbVie. And also, I need to say that the design, the study conduct, and financial support for part of this research was provided by AbbVie, and AbbVie participated in the interpretation of data, review, and approval of the presentation. So I think before we start with the webinar, I think we want to run our first poll through Mentimeter. So I leave Susan to run this, please.
Okay. Thanks, Cesar. So we'd love it if our audience participated in these interactive polling questions. So first, we'd like to know where our attendees are joining us from. Are you a student? Are you in academia? Maybe you're in industry at a CRO or a pharmaceutical company, or perhaps you're with a government agency, FDA, EMA, PMDA. So please go to mentimeter.com. You can enter the code 418049, and we'll give folks a few minutes to participate, and then we can see what how our audience breakdown for today's presentation is. Okay, well, it looks like most of the folks on this call are coming from an industry background, but we have a few folks coming to us from academia, and we're just happy to have everybody join us. And we'll have a couple more poll questions later on in the presentation, and we encourage you to let us know your answers for those. So I'm going to pass the ball back to Cesar.
Okay, thank you, Susan. So yeah, so for today, we prepared this seminar that obviously can be a good source of information for industry or academic projects. And I'll start by giving you some our aims for this work, but also for this particular webinar. Starting by giving you some background on aging and brain size. but also giving you more specific details about how using this effect of aging and brain size in QSP models for neurodegenerative disease drug development. And then I'll show you a more specific example on using the modeling approach on the estimation of amyloid beta concentrations. I'll show you some simulation results just to illustrate how the approach is working in a simulation environment. And finally, I'll go through a few ideas about how the modeling approach can be used in other applications related to neurodegeneration. And I'll conclude the webinar and also give you some additional ideas for future directions of this work. So starting by the aims. So basically what we were thinking is that considering factors like aging become important when analyzing geriatric clinical data. And previous studies have shown the importance of variable size on major organs, like, for example, the liver, where factors like age or gender can be quite important for to determine the liver size. And it has been quite important for physiologically based pharmacokinetic models, PBPK models, and our scientists in SynSIP have been working quite a lot on this. And actually, one of our QSP team members in Certara, Ben Small, wrote a very nice blog about this topic. And obviously, following that, so we were wondering if we could explore the effect of aging on brain size in the case where we want to study neurodegenerative diseases. And this came from our research on Alzheimer's disease in particular, mainly because, well, we all know that this can be a very complex disease and it can be challenging to develop mechanistic models for drug discovery. So our idea is using a modeling approach where we include aging, so we can develop a new quantitative system pharmacology modeling method that considers brain volume changes when estimating biomarkers concentrations. And then you can use this approach to compare the results of a model with a variable brain volume with a model using a constant volume. But also the method can allow you to explore the effect of the variability of brain volume changes in a given population on estimating biomarker concentrations. So I'll give you some background about aging and brain size. And I think that the main message we want to give in the seminar is that basically our brains shrink with age. And the decline happens primarily in the frontal cortex due to neuronal death or degeneration. And if you want to know some rough numbers, so basically the cerebral cortex loses roughly 30% of its neurons with age. And this means that the estimation of this is around 50 to 60,000 neurons per day. And actually, if you want to have a picture of what this means, so I think this figure here illustrates quite well what I'm trying to say. So basically, if you see the image of a 24-year-old male healthy, and compare the brain mass with 79-year-old male, so you can see differences in the brain mass clearly. And then if you think about neurodegenerative diseases, in particular Alzheimer's, so you will see a bigger difference. So basically, what we have seen from the literature is that Alzheimer's patients' brains are about 10% smaller compared to healthy elderly people. And actually, you can see this from this very nice picture, actually. So you see that when we compare a healthy brain from a given from a given elderly population to the brain of advanced Alzheimer's patients, so you will see a difference between the two volumes, let's say. So why is changing brain volume important in QSP? So I think that this question came because we were trying to build a model for, as I mentioned, for Alzheimer's disease, and then we realized that in general, physiological modeling and simulation assumes a constant brain volume. But actually, if you see data relating aging and brain size, so you will find this kind of picture, the one I'm showing here. And basically what you see is that, so I think this is a good picture where they collected data for different age groups and also for different genders. And the first message we get from this picture is that you see that we have some kind of development phase of the brain until the mid-20s, let's say. And then the volume or the size of the brain start to decrease with time, basically. And this happens for both for females and males. But also, I think another important fact from this picture is that the brains of females compared to males is different as well. So we have some males. Men have a bigger brain in general if you compare the different age groups. So the idea of applying this or of using this information in QSP is that if we need to study neurodegenerative chronic diseases, so basically what we were thinking is that changes in brain volume are important to estimate the concentration of specific brain biomarkers. So, for example, amyloid beta, cholesterol. Well, you can think about any kind of biomarkers that you are trying to measure in the brain. And I think this at this stage, I think we have our second poll where we want to see your opinion about different biomarkers. Oh no, sorry.
Okay. So as Cesar mentioned, we've got a poll question for you guys. This is free text. We wanted to know what brain biomarkers are the folks that are listening to this webinar interested in building models for. You can just type in your answer and it'll appear. This is really interesting. I'm seeing a number of options that folks are putting in. Some folks are looking at cytokines. They're looking at IL-6 and TNF-alpha, insulin, inflammatory panels, A-beta, tau. A lot of you are interested in transferrin, CSF turnover rate, cholesterol. Great. That's good to know. I think we might have some surprises in here. So thanks, everybody.
Yeah, thank you. Very useful information, actually. So I'm very related to, obviously, to to this webinar because we selected an example related to amyloid beta, and some people is interested in this biomarker. Talking about the specific approach we are taking for our QSP model. So basically, what based on what I mentioned before about the different phases for brain development and then brain shrinking, if you want. So the idea is that we are going to implement a model where we have where we include these two phases. So we will have a model for the brain volume where we have this initial development in size, and then after the mid-20s, let's say age is around mid-20s, so we will have this size decreasing, as we can see in this kind of plot we have here. So let me give you more specific details about the model that I'm going to present. So as I mentioned earlier, so it's about Alzheimer's disease. So we selected one specific example for this webinar, and as you know probably, so trying to identify different points of interventions in Alzheimer's disease can be quite complex. So there are plenty of different targets in the literature where that seems to be interesting to treat the disease. But in our particular case, so we selected to model amyloid beta, as I said, so for this example in the webinar. And just to give you a bit of more information about amyloid beta and why it seems important for Alzheimer's disease. So basically, amyloid beta forms from the amyloid precursor protein cleavage, the APP cleavage, in the cell membranes, and there is a possibility of forming a different type of the peptide, the A beta peptides, and A beta 42 seems to be especially toxic. And we say it's toxic because what we see in Alzheimer's brains is that we have elevated A beta levels, and this and A beta tends to aggregate to form plaques that disrupt neuronal function. And if you can, if you try to imagine what is happening to the brain with these plaques, so you can see this in this nice picture. So basically, you can imagine that a healthy brain where you have all the neurons behaving in a natural way without any kind of disruption in the system. But then for the Alzheimer's case, so you can imagine that you have this kind of plaques between cells that are basically perturbing the system and generating some kind of disruption in the cellular functions. So so that's why amyloid beta seems to be an important biomarker for the disease. Now, once we selected the specific biomarker or the specific biological mechanisms we wanted to include in the model, so we needed to understand a bit more the specific mechanisms related to A beta production. So and as I said, so basically we needed to build our initial biological map, let's say. So we started with this with saying that the process started with the cleavage of APP to the cell membrane, and then there are two possible pathways after this. So you through two different enzymes, alpha secretase or beta secretase. So if you see what happens through alpha secretase, so basically there will be the production of what we call the soluble APP alpha and C83, and then through gamma secretase, there will be the production of another peptide called P3 and AICD. Then, if you see the other side of the pathways through what happens basically through beta secretase or base 1. What will happen is that you will produce a similar soluble APP, in this case is APP beta, and also C99, and then this will produce through gamma secretase, so this will produce the A beta peptides and also AICD, and then we included an additional step in the process where we say, well, that we also can generate this kind of insoluble A beta species that are the main components of the aggregates and the ones that are producing the plaque. So once we had this better understanding of the biology and what might happen with the APP processing, then we needed to write the mathematical equations related to these processes and to the different kinetic rates and so on. So what we did for this particular model, and this was published quite recently in CPT PSP as part of our collaboration with AbbVie. So what we did was using a model coming from the literature, which was published by Potter et al. In 2013, and we used this model to model the production of the A beta peptides, and then for the other side of the model, if you want, the alpha secretase pathway, we used the model published by Ortega et al. In 2013. So if we want to see more details about these models, so basically this is a picture or a diagram of each of them. So as I said, so basically the Potter's model is about the production of the different A beta species, and then for the branch related to C83 and P3, we use the Ortega model, and these are the references if you are interested to see more details. So then, once we had defined the model for A beta production, as I just mentioned, so we needed to incorporate this model of variable brain volume. And what we do for this example is that we found this nice paper where they basically did a meta-analysis from different papers from the literature in order to extract data relating age and brain size, and then they tried to fit different mathematical models to the data, basically, and that's why you see different plots here. So. But they managed to get a final model where they capture the development phase, and then also they capture how the size decreases with age after 20 years old, which is this model, which is more complicated in a way. So we decided to take this model as our model for variable brain volume. And then if you try to think about the different approaches you can have using these models, then you maybe we can summarize this in three different possible approaches. So you can stay with the constant brain size, where you will have a constant brain for any age you use in the model, and this can be useful in cases where actually the brain size is not very important, or maybe your time span for the simulation is not very long. So you have very short time for the simulation. So actually the brain is not changing a lot in a short time period. Then you can have a model where you only consider the development stage. So as I show in this plot. So basically you have you capture what happens with the brain until you arrive to this kind of maximal value, and then you consider that the volume stays constant with age. And again, so this can be useful for specific applications. So for example, if you are using the model for a pediatric application, so you can use a model like this that actually is simpler than the previous models I showed. And then you can have the complete picture. So you can have the complete dynamic model for the brain, which is the one we used for this for the sample of this webinar, where you have the development stage, and then you have this kind of shrinking stage with age after the mid-20s, let's say. So summarizing the modeling approach I'm showing here. So basically we have this first stage where we develop the model for A-beta production and accumulation in brain, and then we combine in a second step this initial model of the APP processing with our brain aging model, let's say. And this is what we basically implemented in the software for the simulations. So just to show you how the simulations look like when we implemented the integrated approach with the original model and the brain volume changing in time. So this is our first set of simulations we got from using different parameter values for different type of populations. So basically, we have a set of parameters for the brain volume for a male population, different parameter values for the female population, and then we created a virtual population for which is mixed, which is 50% male and 50% female. What you see here, so the points are data points coming from the literature. The solid line is the mean simulation results from our virtual population, and then the shadows is the confidence interval, so is the 5th and the 95th percentile coming from our virtual population simulation. And we managed to get this variability coming from the variability we got for the parameters we use in the brain model for males and females. And basically what we were trying to verify with these simulations was that we were covering the variability we see in the different data sets we got from the literature. So you see that basically applying this variability in the parameters of the brain volume, so we managed to get the same. So we managed to cover the data points we got from the literature. Then the next simulations we try was where we say, well, now that we have the model with the variable brain volume, so let's keep the same variability in the brain volume, and let's obtain our estimations of insoluble A beta for these three different virtual populations. So what you see here is so the solid line again is the mean simulation results for the virtual population. The shadows is the confidence interval, so the 5th and the 95th confidence intervals from the virtual population simulations. And the dotted line is the simulations you will get if you use the same model but with a constant volume for the brain. So you see that the change, so that it's almost constant. So if you compare the levels of 90 years old with a 30 years old of insoluble A beta, so it's more or less constant if you don't introduce the variable brain in the model. And the same happens for the 3 different virtual populations we use, so for the male, the females, and the mixed population. So that's fine. So obviously that was interesting when we got these new results with the variable brain. But actually we wanted to compare this also with some data coming from the literature. And this is my next slide. So basically, in this case, we are comparing the our results from the simulations from a population of 95 years old compared to 30 years old. So we are so this is so basically in this plot one indicates the levels of A beta for a 30 years old population. So we normalize these values, and then we compare with data coming from this paper where is a similar comparison. And you see that for the mixed population, for example, so the model tend to have the same behavior we see in the data. Then for the females, it seems the model under predicts a bit what we see from the data. But actually for males, the model seems to be very concordant with what we see in the data. So the solid lines is the data, I forgot to say, and these are the simulations, the other bars. So and obviously this was really interesting to see. So basically it seems that just applying this additional feature of variable brain volume in the model seemed to be useful to obtain similar results as seen in data coming from studies published in the literature. And I think now is our time of doing our last Mentimeter poll. Susan, please.
Okay, thanks, Cesar. So our last question for our audience is, we'd like to know whether you consider aging and brain volume in your models. So we've got a couple options. Maybe brain volume isn't relevant for your model, or maybe you haven't been incorporating brain volume into your models, but you'd like to incorporate these factors into the model. And then we've got a last option of maybe you're already doing that. Maybe your models already are factoring in the impact of variable brain volume with age. So we'll give folks a few seconds to let us know what they're doing. Okay, well, it looks like most folks have entered their responses. So this is really interesting. It looks like the majority of people aren't considering variable brain volume in their models, but they're interested in incorporating that factor. And that seems about evenly split between people that don't feel that brain volume is a relevant factor in their models versus folks that are already taking these factors into account. So I'll pass back to you, Cesar.
Excellent. Thank you, Suzanne, and thank you all for answering the question. So basically, for us, it seems an important factor as well. So, and one of the things we are thinking about using this approach is expanding current models, for example. So, so this is one example I'm taking from the same paper from CPT-PSP I mentioned earlier of our collaboration with AbbVie. And you can see from this model that we have a component related to APP processing, and obviously we already saw that this will be affected by adding this additional effect of variable brain volume. But also, this model also considers cholesterol metabolism and sphingolipid metabolism in the brain. And obviously, we have the question of now if, these changes in brain volume might affect also cholesterol levels or sphingolipid levels. And obviously, this might be a nice application where we can explore the effect of variable brain volume. Then, thinking beyond that, there is a nice paper again in CPT-PSP that has been published quite recently, where the authors, and actually one of the authors is B.G. Chelia, actually the senior author of this paper, which is also one of our colleagues in the QSP team in Certara. So I think the one interesting thing from seeing this picture is that actually what they found is that already in 2017 there is a possibility basically of applying this approach to more than 89 mathematical models that are related to neurodegeneration. So obviously that gives us more opportunities, let's say, to think about applying this approach in other biomarkers or other mechanisms related to brain or to the brain or to neuronal function, let's say. And just to finish with future work, so basically I just wanted to say that we are in the process of creating a new neurodegeneration consortium in Certara, and this is based in our very well-established consortia in immuno-oncology and immunogenicity. And obviously, I want to say this for people interested in the audience, and obviously, please get in touch with us if you have any question or you are interested to know more about this consortium. Right, and this leads me to my conclusions. Obviously, very brief conclusions because of time, but so I just wanted to show you that simulation results from the integrated QSP model suggest including variable brain volume can help to improve our dynamic description of the neurodegenerative chronic diseases in geriatric populations, but also it can help to facilitate the estimation of biomarker concentration levels in the brain, and very importantly, it can help to build more realistic scenarios for evaluating pharmacological interventions at different ages. So I want to thank very much AbbVie for supporting this work, in particular Diana Klosnitzer. But also I want to thank my team, the QSP team in Certara, in particular Neil, who was part of this work. And I want to thank Suzanne and Christopher for the help with the webinar and the slides and all the logistics to make this possible. And finally, I want to thank everyone in this call for attending the seminar and for answering all the questions. And I'm more than happy to answer any questions if you have. Thank you.
Thank you so much, Cesar. We encourage our audience members to go to the Q&A panel at the bottom right of your screen and enter your questions for Cesar there, and we will answer as many as we can in the time allowed. So, Cesar, looks like we've got a question from our audience. Do you think that there are specific parts of the model that could be further explored? For example, A-beta synthesis rate.
Right. Yeah. So obviously, this was only an example for the webinar, and but at the same time, is already giving us some information about what we are doing with the A-beta models in particular, and so. So, for example, one of the things we are seeing is that only applying this variable volume in the model, we are already seeing changes in the A-beta levels. But actually, we're assuming that the kinetic rates are the same independently of age, and maybe this is something that is also changing. But obviously, we need to explore this further, but it's a good question. So and this obviously can be explored in future.
Someone wants to know, what are your thoughts on brain volume versus brain mass?
This is a good question because for the example, we assume that the density was equal to 1 basically, so 1 kilo equals to 1 liter. But this is something that maybe needs to be maybe it might be important for some cases. In this case, I think it's fine. So assuming that the density is equal to the water density basically. But yeah, it's something that maybe you can consider a different density for the brain if needed. So because obviously what we see is that mass is changing with time in the same way as volume, but maybe the density can be a bit different.
One of our attendees would like to ask you, is there anything known about ontogenic changes in cerebral spinal fluid rates of formation and absorption, and how does this play into brain volume changes?
Sorry, Suzanne, can you ask the question again? Because I lost something.
I think what the person's asking is that with development and aging, there's changes in production of CSF and absorption. I think we see that the ventricles get bigger with age, and so I think she was asking how this affects brain volume changes.
Yeah, obviously this is something that we are also thinking about expanding this approach, because obviously we are only considering how the brain volume is changing with age, but we are not implementing any kind of physiological or biological information to the brain volume. But obviously this is something that can be included in future versions, where the changes in the volume will be more related to physiological mechanisms instead of time only. But yeah, that's a good question.
We're getting a lot of questions from the audience. This is fantastic. One of our attendees would like to know, what software and version were these models implemented in?
Yeah, good question, because I forgot to say. So this was implemented in MATLAB, and we use for the example you saw in the slides, we use MATLAB 2016b, but and actually the model part of the model is available in the CPT PSP website. So if you go to the to the paper I mentioned about the model.
Someone says, it looks like you were assuming that the brain was a homogeneous mass. Did you, or how would you take into account changes in the volume of CSFs or ISFs specifically? It sounded like you answered that, but I don't know if there was anything you wanted to elaborate on that.
Yeah, I think this is a related question. So yeah, so for this example, it was yeah, we are assuming that it's a homogeneous mass, but actually yeah, we have in the model we have an additional compartment for CSF, but we consider it is an homogeneous volume for this case.
Okay. Do you think that brain size would significantly impact cholesterol levels?
Probably. So obviously I don't have the data to show this, but what we think is that brain size is affecting any kind of biomarker concentration you have in the brain. But the thing is, what we don't know, obviously, because we might need to do some research around this, is that probably some biomarkers are maybe are regulated in a different way, and maybe the concentration doesn't seem to be affected by the brain size. But I think for cholesterol in particular, maybe the brain size is an important factor.
Someone wants to know about how much information is available for brain size changes in pediatrics.
Well, the information, I think we found some information about some people collecting data for pediatric applications, so where they try to basically develop models for how the brains develop. But yeah, so I don't have the information here, but I know some people is working on this. Yeah.
Looks like we've got 2 more questions. Have you considered scaling brain size for pediatric applications, which has been done in the field of PBPK?
Yeah, so as I said, so I know people is working on this. Our SimSip scientists know more than probably know more about this for the PBPK case. So yeah, but it's definitely something that is very very important. So in cases where you are trying to explore biomarkers in the brains for pediatrics, because obviously the changes are at early stages of life, let's say. So the changes are quite important. So you see that it's very steep how the brain is developing. So the changes, the volume is changing quite rapidly, if you want. So this seems to be a really important factor.
Looks like we've got our last question. Someone would like to know, you talked about changes in brain volume with age. Do you know whether the interstitial volume in the brain also changes with age?
Yeah, this is a very good question, because it's something we are trying to explore now, because obviously, yeah, I show only the changes in the mass, brain mass, but we were wondering if this will happen also to the interstitial fluid. So I don't have the answer now, but this is something we are exploring basically. Yeah. Good question. Thank you.
Great. Thank you.